the next topic that we're gonna talk about. And what you're gonna see with fibroids is they are solid benign tumors, and they're in the female pelvis. If some of y'all heard some crazy stories with people having some like super large fibroids, like even to the point where they thought they were pregnant, like they were so large they had to go in and have surgically removed because of the size of them. So a lot of times they are the leading cause, the fibroids are the leading cause of the need for hysterectomies. They, the tumors, it mentions there that they kind of originate in the muscular tissue of the uterus, but they really don't know why. So there's really no rhyme or reason, etiology unknown. They are dependent upon ovarian production of estrogen and progesterone. Imagine that, everything we've talked about is fed by estrogen and progesterone, right? So the clinical manifestations, the vaginal bleeding, the pelvic pressure, and probably the excess of the vaginal bleeding a lot of times is the reason that the hysterectomy is going to be necessary, because it's just no other way to remedy the problem. They may experience very heavy menses because of the increase in the size of the uterus or the endometrial size as a result of these growing fibroids. They can have significant pelvic pressure, painful intercourse, they can have painful urination, and even difficulty with defecating. So even difficulty with their bowel movements. So you think about these fibroids, we got them in the pelvic cavity, and they can manipulate and interfere with everything within that pelvic cavity. So that's why you have to think about the urine and the also the bowel movements being affected as well. So a lot of times this is based, the diagnosis is a lot of times going to be based on someone identifying these particular clinical manifestations. So these symptoms are going to help with the diagnosis. Also an ultrasound. There's just a picture of those. But an ultrasound is showing MRI, but even with a physical assessment, like I said, sometimes they can grow to the size that they can be visually identified, or they could also maybe be palpated, especially if there is some type of pelvic exam done. So the MRI can help with defining the size of it. And then as far as the treatment goes, it's primarily going to focus on hormone therapy for the reduction of the symptoms. So the estrogen and progestin, the oral contraceptive pills can kind of help with the controlling of the bleeding and the painful menses. But the problem with the medical management is that it just usually yields short-term results, and therefore they end up, they last for a short time and then they're kind of right back in the same situation, which leads to what was said at the beginning, that it's the leading cause of hysterectomies. It does also talk about the lupron, the luprolide that we talked about in detail with the endometriosis. They can actually kind of induce a false menopause, because we talked about it throws the body into a hypo estrogen state, and then induce a false menopause that could result in the decrease in the size of the fibroids. But the problem with that lupron, you can't just stay on it forever. It's just a series of months that you get those injections. So it's not something, so you can imagine once that's gone, the problem's not eliminated, and then it could help for a time, but then the problem returns. So it says that a lot of times the lupron, what it mentions in your book, those gonadotropin releasing hormones, can be used prior to surgery. to help with shrinking the size of the tumor, so then that way when they go in and do the surgery, they can be more successful with removing the fibroids if they're doing that, or maybe even just with the success of the hysterectomy if the fibroids are smaller in size. And it does just mention a few different other medications, but the surgical options are going to be the primary tool. Hysterectomy or surgical removal of the uterus is going to be the most common treatment. It's permanent. It is going to eliminate all future fertility options, so that's where we have to, we've got a woman of childbearing years and she has fibroids. That's where we may have to do some more conservative management to maybe make the best option for her to be able to have children. Yes, Mackenzie?
Is the removal of the uterus still a hysterectomy?
Yes. So yes, that'd be partial. So a total hysterectomy would be the uterus and the ovaries, and then a partial would be just the uterus. Yeah, that's correct. So they can, the hysterectomy can be done a couple of different ways. So laparoscopically, they do the abdominal incision, or they can also do a vaginal hysterectomy where they actually remove the uterus through the vagina. Or depending upon what is involved with it, they may need to do an open abdominal incision. So of course, if they have to do an open abdominal incision, then you realize then that they're going to have to, they're going to have more of a prolonged recovery time. There's going to be more limitations on them as far as what they can lift and all of those things, because we've got an abdominal incision. An abdominal incision that we are trying to keep from busting open. So you can see from that that's going to kind of vary depending upon. There may also be the robotic assisted. Did some of y'all see that in surgery? Got to see a robotic assisted hysterectomy done. So that's very cool. But it does talk about, when you read through the medical management, that if fertility is a priority, a surgical procedure called a myomectomy is used, and that's just where they're going to remove the visible and then maybe even some of the fibroids that are more hidden, but remove some of those too. Like I said, give them the best opportunity to be able to have a child. Another thing that they may do is the uterine artery embolization. So maybe they cut off the blood supply, they do an embolization to that artery that's feeding the fibroid, then that could cause it to shrink and die off. And then it also mentions one other thing, an MRI-focused ultrasound to penetrate and destroy the fibroid. So you see that there are different ones, but as far as what you would need to know about it, really just hysterectomy is really going to be the best treatment, and then you're going to monitor for the complications of hysterectomy, and then if they are of childbearing years, some of those other options may be used in those situations. So let's go ahead and pause there. It's about 10:55, so let's come back at 11:05.